Today we're talking about part of healthcare most patients never see, the supply chain, and why it may be one of the biggest levers for cost, quality, and outcomes. Professor Rosenberg's book argues that when supplies and medication don't arrive on time, the impact isn't just inconvenience, it can be life critical. My name is Aileen Vega. I am the Director of Corporate Education and Training here at Middlesex College and the host for today.
Today's episode of Expert Spotlight. Professor Stuart Rosenberg, interviewed by Aileen Vega, Director of Corporate Education and Training. Let's learn from the experts in the supply chain.
I have my guest with me today is Professor Stuart Rosenberg. Hello, Professor. How are you doing?
Hi, Aileen. Thank you for having me. Pleasure
Thank
to be
you for
here.
allowing us to give you this interview today. Professor, for our viewers, can you tell us a little bit about yourself and tell us the problem or moment that convinced you to write this book on this particular topic?
Sure, I'd be glad to. A long and varied career in supply chain, holding various positions in a couple of different companies. What I noticed about the supply chain was the driving force in my career and writing the book. People don't really know or educated about the supply chain, and they think they don't understand what it means, the supply chain. What it means is basically everyone involved in either completing the product or the service, whatever that happens to be, whatever the product, in this case it's healthcare, but we'll get to that. In my past life, I saw a number of times where the supply chain was broken. And what I mean by that, somewhere along the line, from the supplier to receiving at your own building, through warehousing the goods and production and packaging and then shipping, to make it a little bit simpler for our watches. If anything breaks down along the way, let's say you're receiving your product, but some of them came in damaged or unviable, or you think they're unviable, and they has to go to quality control. Well, that other things down the line stop. In other words, production, they can't make the product. Packaging, they can't wrap it up and put it in boxes or what have you. And it can't get on the truck in time for the customer. So customer suffers at the end. Same thing in health, and I've seen that a number of times. And through my career, I've had the responsibility of fixing that and making sure it doesn't happen again, or mitigating it to the point where it's tolerable. And what I've seen in my research in healthcare, that mitigation is nowhere in force. There's a number of breakdowns along the way, and everybody has to be involved. Everybody in healthcare, from the supplier to the manufacturer to the distributor to the healthcare providers and institutions, have to be involved in ensuring that the breakdowns are mitigated, because the end customer is not just a company waiting for their product, but in this case, it's a patient's life that could be at stake. And that's what drove me to write this book.
And the name of the book that Stuart speaking of is the book that he wrote entitled Global Healthcare and Supply Chain, Revolutionizing Healthcare, One Patient at a Time. And I'm glad you said that, Stuart, because that leads me to my next question. Have you ever experienced a coordination breakdown?
Yes, in healthcare. Unfortunately, not me personally, but someone very close to me, my spouse. She was supposed to go in for a knee replacement surgery, and it's not life-threatening, but still, she was supposed to be in a hospital. She was in the hospital a day before the surgery, and then she was supposed to stay in the hospital for a couple of days afterwards for recovery purposes. However, what happened? They had to cancel the knee surgery because they didn't realize that they didn't have all the supplies they needed. So instead of spending 3 days or 4 days, she ended up spending in the hospital a week and a half till the supplies were replenished and they had to reschedule her surgery. In this case, it wasn't life-threatening, but as we all know, stress, and this is what happened to her. She increased the stress days, and the stress just reached a level that was unacceptable.
So it sounds like the supply chain around her actually broke.
It did.
Yeah,
it did. Being my whole career being in supply chain, it wasn't a surprise to me, so to speak.
Yeah.
But it didn't make me happy at the same time.
If you had to distill the book's core argument into one sentence, what would it be, and what misconception does it correct?
The one sentence is very simple. The healthcare industry is ever changing, and it has to change. Okay? and the role of supply in the supply chain has to change with it. The misconceptions are two that came to mind. One is visibility. Many people take the supply chain for granted until something happens. In this case with my spouse. Now, I didn't take it for granted, even though I was, her husband, because as I said, I spent my whole career in supply chain, and I've seen it happen before. But in certain industries, it should never happen, and this is one of them. Healthcare should never happen. The other thing that I believe has to change is the specialized expertise. Not so much in doctors, because that's where they go to medical school and then they specialize in a particular field. That's fine. But the hospitals themselves and the clinics should not be specialized. In other words, one or two hospitals, one hospital should not just have a specialization in heart care or heart surgery, and another hospital orthopedic surgery. Every hospital should be able to help patients in every way. And if somebody comes in for orthopedic, even though you're supposed to be a heart hospital, well, you can still go to that hospital for a knee surgery or back surgery or what have you. A myth, a misconception that should be changed.
What would you say is the most common invisible cause of delay? Something that we don't actually see but often occurs in healthcare.
Well, what many people don't understand is very simply, most of our medical supplies, instruments, or the drugs are made overseas. So many people don't see the transportation issues and logistics issues with moving from point A to point B, meaning from the manufacturer to the hospitals to the patients. And they don't see it until, again, there's a breakdown, and then they wonder why, what happened, why. That's the most invisible one. People take it for granted until it's not there.
How did you gather the insight, Stuart, to write this book, and what surprised you the most about the previous assumptions?
Well, I gathered my research and articles and data from the Center for Disease Control, the U.S. Department of Health and Human Services, the FDA, Food and Drug Administration, and this agency that very few people know exists, the Agency for Health Research and Quality. They disseminate all kinds of data, and that's where I've gotten some of my research. The research also I gathered from doctors that I know, actually relatives in my family, who I questioned, and they were more than happy to tell me their thoughts and their insights. The one assumption that surprised me was everybody talks about access to healthcare, but the quality of that access needs to be elevated to the point where everybody gets quality access to healthcare.
And that leads me to the next question. What capabilities do employers want, and how to train these employees? Because if you don't train people, the quality is not going to be there.
I agree. No, I agree with 100%. Well, whereas industry outside of healthcare have revamped their recruiting, and now they're more interested in so-called soft skills like communication and analytics and detail-oriented and listening to people and having good judgment and teamwork and leadership, as opposed to managing day-to-day operations. They want leaders. And before this, the health field never did this. But now, especially hospitals are re-gearing this so-called recruiting, their recruiting capabilities to include and demand these skills.
Do you think that at some point we can get clinicians to care about supply chain without making it one more thing to worry about? Because they're sort of like all over the place, How can we get them to that point?
I think we can't make them experts, but what I think we need to do is sit them all down for a few hours or a week in a supply chain courses and make them understand what it is. Because right now, when you ask a doctor, a nurse, or anybody, or even an intake person in an emergency room, and you start having a conversation about supply chain, and you get blank looks, and they really don't understand what it means until there's a breakdown in getting medical supplies, and then all of a sudden, you want to wake up and realize the vital importance of strong supply chain not breaking. So it comes down to education, really. And again,
or maybe continuing education.
continuing education. Yeah. Well, education in any form, yes.
So let's change gears a little bit, Stuart. Where does technology move the needle in your book?
Even in healthcare settings, hospitals, clinics, even the doctor's office, automation is taking over, okay? Technology is revamping a lot of things, including transportation and logistics, what they call cold chain today, which is basically upgrading what refrigeration was in the past. If you transporting on an 18-wheeler, for instance, you have various different kinds of medical supplies. On the old refrigeration trucks was at one temperature, whatever that temperature was. But today, with cold chain, you, on an 18-wheeler or any size truck really, you can they're building non-structural walls and separating by compartments certain and every medical supplies, including drugs, which need to be stored at separate temperatures, and that's what they're doing. And that's how they're transporting all these medical supplies to the end customer, whether it be hospitals and patients. And the hospitals, at the same time, need to revamp their supply warehouses in the same fashion, where they have different supplies at different temperatures, et cetera, down the line. This will keep all the medical supplies, whatever they are, viable until it has to be used for the patient. The other one is robotics. Everybody's afraid of robots taking over. But right now, all they're using robotics in hospitals to alleviate repetitive motion. They're not replacing surgeons, not replacing doctors per se yet. Who knows what will happen 20, 30 years, but right now, the robotics are only alleviating the repetitive motions. So that's supposedly freeing up more time and for the doctors to spend with their patients.
So definitely technology is an integral part of the healthcare system. Where do you think these technologies add value versus complexity?
Well, that's the debate. We're using these technologies, including AI, when does the complexity and the lack of understanding turn into value for the patients? And that's yet to be determined, unfortunately, because AI is still a work in progress. Maybe in 10 years we'll know it, or 5 years, but right now nobody knows what's going to happen with AI as far as when is it turn into true value for the patients.
Now let's talk about collaboration, because this is really important. What role do academia, employers, public or government agencies need to play to achieve the goal of improving patient care?
They all have to play a part in it, and how much they all play a part in it is going to be a debate at this point in time, especially for the government and the public. But as far as academia, and when we talk about academia, we're talking about the medical colleges where they go to get their training. At present, in many medical institutions, they only teach the clinical side of treating the patients. There's no courses or guidelines about empathy, communication, collaboration, sympathy, or listening to the patient. Only the clinical nature of it, and that has to change. We have to retrain our future medical students to become, I guess if you want to call it, more human to their patients. So when they do make rounds with their instructor or resident doctor, it doesn't become a case study, it becomes real patient care because they're discussing the patient's case with the patient. Right now they're not doing that. As I mentioned before, they're just discussing it amongst themselves, but not discussing it with the patient, and that has to change. But that is going to change if the medical institutions and the medical colleges change their program. As far as employers, again, the employers have to, in the hospitals, clinics, doctor's office even, they need to hire their healthcare professionals, whether it be nurses, nurse practitioners, physician's assistants, encourage a culture of research and developing collaboration and communication with the patients. And again, back to the government public, how much government interference do we want? We know healthcare has to be included, but how much government interference or government enterprise do we want? And that's a debate. Do we want government interference like a socialist country has, like Sweden, where 51% of all hospitals or medical institution is owned by the government, so they have to follow whatever the government says? Or do we want to continue with free enterprise, where government has very little input? So that's a debate that's going to be going on for healthcare for a long time, and nobody has the answer for that now.
And what can government and private sector collaborations look like when a crisis hits, as we saw with COVID?
I'm glad you brought that up, because everybody's still talking about that time of life, and it wasn't that long ago. When we went into the pharmacies, CVS, Walgreens, and we went into the supermarkets, the shelves were bare. We could barely go food shopping and get medical supplies, paper towels, basic stuff. Okay. And people were blaming the government for this left and right, and they didn't do enough, they did too little, what have you. Okay? But the debate was, how much government interference should we have had with these companies that were all the manufacturers, not just the medical supplies, but all the manufacturers on the food side of it? How much interference should the government have made to ensure product on the shelves? Again, that's a debate that I don't think will ever end. I mean, it was exposed and highlighted because of COVID, but now unfortunately, it's fading more into the background. There are some clinicians that are still debating that, and trying to get government agencies more involved in the discussion, at least.
Right.
The CDC, the FDA, U.S. Human and Health Administration, etc. So that's where we stand right now with the government and public.
And as we get to a closing in this interview, I'd like to ask you, what part of the book best demonstrates the thesis for this book?
I enjoyed writing the whole book. I didn't think of one particular thesis, but if I had to pinpoint one, I think I'd have to go back to what I mentioned before about the visibility and educating the public at large. And some of that education, I think, is on the public themselves, to educate themselves. When they get test results back before they go see the doctor, I know it's time consuming, but maybe they should somehow read it and try to question it. Go on Google and questions about this and this and that. So when they go to see their doctor, they're not completely in the dark. They have some education that they can actually then converse with the doctor and ask even more questions. Again, and back to the visibility, many people don't realize the supply chain is there until it breaks down and they don't get what they need.
If the reader only remembers 3 ideas, what 3 ideas do you want those readers to remember?
Well, one is actually patient care and experience. As I mentioned before, this is going to take time with the training, with the new training in the medical colleges and universities. But what has to happen is the level of patient care and empathy with the patients, communication with the patient, and listening to the patient. So we have to raise the level and the expectation of patient care. The other thing is, when we talk about cost reduction and efficiency, people don't realize that they go together, but they automatically assume cost reduction is, okay, we're going to fire people. We're going to fire doctors, we're going to fire nurses, we're going to fire intake personnel in the emergency room. We're going to, even a receptionist, instead of 2 receptionists, we're going to have 1 receptionist. They don't understand the impact of this on the patient and the patient well-being. What I'm talking about here is basically stress, and how stress interacts with our body and makes our health even more in jeopardy. Because many people fail when they get to cost reduction again, but they have to concentrate on what costs are you reducing in order to help to better patient care. Will cutting labor, personnel, increase patient care? I don't think so. But that's the mentality we have to get rid of. What other expenses are there that we can control and mitigate that will not threaten patient care? That's where we come into it, and that leads to the efficiencies of patient care. The last one, the access to vital medical supplies, okay? As I said before, most of our medical supplies, whether it be physical medical supplies like canes or walkers, including the pharmaceutical items, come from overseas. So we have to realize that and understand the transportation aspects of it and the logistics aspects of access to medical supplies and getting all this to the patient while the medical supplies are still viable and in a timely manner. So everybody's involved in this. As I said before, the suppliers, the manufacturers, the distributors, the healthcare institutions themselves, whether they be the hospitals or medical schools, okay, and the doctors and nurses. They all play a part in this.
So what is the one term you wish healthcare stopped using about supply chain?
Okay, the one term, I don't know if it's one term, but when I go and part of my research was asking doctors about the supply chain, I got a very blank look. They themselves were not clear what the supply chain was or is. In my interview, in my research, I had to go explain it to them as best I could. But I think as part of their own continuing education, because doctors as well as everybody else should never fail to continue their education. And this is one part of it. I think somewhere along the line, they have to be educated about what supply chain is and what it really means from your supply all the way through the patient and what can happen if there's any interruptions along the way. And not just tell them that supply chain is of disciplines. That means nothing. We have to get down in the petty details, if you may say, and show them that the supply chain is real, people on the supply chain, real companies, and what happens if something does break down along that supply chain. You know, a perfect example is now the Straits of Hormuz is being blocked and only certain things are being let through because of the war. Other things have happened in the past. The Suez Canal was blocked for a number of months by certain parties and we couldn't get ships through there. Medical supplies and other things were delayed, but that has to be accounted for.
Hope that now that you have this great book, the more doctors and other people in healthcare can read and understand the impact and what supply chain really means in the medical system. If people want to learn more and purchase your book, how can they do so?
Oh, very easy. They can contact me at Stu Rosenberg 24@gmail.com, and I'd be more than happy to talk to them about the book, or else they can find the book on Amazon and Barnes & Nobles and Walmart, or they can contact the publisher directly, Routledge Publishers.
The book?
Yes.
From Stuart Rosenberg. Stuart, thank you for the interview, and for our viewers, please don't forget to hit the bell and subscribe. Thank you. I'm Aileen Vega, host and Director of Corporate Education and Training. See you in the next interview.
Thank you for watching. Don't forget to subscribe to Global Supply Chain Webinars for more.